everybody. My name's Jacqueline. It's great to see you all again virtually. And I'll be talking about my conceptual framework and how it relates to emerging trends in nursing science. So I'm primarily interested in moderate intensity physical activity, resistant hypertension, and oxidative stress in sedentary African American adults. So let's start about the inspiration for this line of inquiry. So I'm going to briefly take you through my journey in my career. So I started off as a brand new nurse right out of high school in the COVID pandemic. And I worked med-surg. And every day I got to do what I'd call the Great Med Pass. I felt like I spent a majority of my clinical day passing meds for my 8 patients. And a lot of times I went home and I felt unfulfilled. I sometimes felt like I wasn't really changing anything, that all I was doing was giving 8 patients meds, providing continence care, and going home. I didn't feel really involved with the care plans. I didn't really even feel like I knew what was going on with that many patients. And one day I worked a day shift. And it was so interesting to me because I had these 8 patients. And suddenly I had 0. And I was thinking to myself, where did everyone go? Where are all my patients? And at that time, they all left to go to dialysis. And I got to thinking to myself, why is this such a big issue in my area? How did I not know that this was so prevalent? So I spent a few more months working in med-surg, and I kept pondering that question. And I decided I wanted to make a shift in my practice and decided, well, where's the best place for the idealist? In my mind, I was thinking the emergency department. Now, I bet none of you all guessed that because, well, the emergency department is often less than ideal. But in order to explore an issue and see what's really going on in your community, the emergency department is a great place to get to the bottom of it. And at that time, I felt like my eyes were wide open. I got to see people come in with uncontrolled diabetes, uncontrolled hypertension, poor physical activity, poor nutrition. And I saw these patients over time develop a worsening health status. And that's when I first started to have those big questions. How does this all connect? What can we do as nurses to change this? Can this be changed? And ever since all of my patients had that mass exodus to dialysis, I've been pretty intrigued by chronic kidney disease and what we can do before we reach end-stage renal disease in order to prevent that from happening or at least prolong that outcome. So just a quick background, chronic kidney disease is a progressive disease that will eventually advance to end-stage renal disease. We're really looking to manage symptoms, prevent further renal damage, reduce cardiovascular risk, manage blood pressure, and manage our medications appropriately. Clinical practice guidelines recommend 150 minutes of moderate intensity physical activity per week, but many patients don't reach this goal. Consistent participation in moderate intensity physical activity has been found to decrease indices of oxidative stress, and sedentary lifestyle increases the risk of oxidative stress. So I found a gap in the literature regarding the relationships between level of physical activity, oxidative stress, and resistant hypertension. We really haven't looked at all of these 3 factors together. And much of the literature that looks at an oxidative stress biomarker, 8-OHDG, focuses on pharmacological interventions. So if we were looking at a physical activity intervention, this could be a complementary approach that could really do this population some good. So my overarching question right now is, does participation in the recommended 150 minutes per week of moderate intensity physical activity reduce blood pressure in African American adults with chronic kidney disease? So most of you are familiar with most of these concepts, but I do want to point out oxidative stress. which is defined as an imbalance in oxygen-reactive species that often occurs at sites of inflammatory processes or in response to environmental stressors. And I have my conceptual framework that I'm working on right here. I'm really open to any feedback that you might have. But we start off with sedentary lifestyle. I believe it's an antecedent for oxidative stress, and I propose it to have a causal relationship. Through the Walker and Avant method, antecedents must occur prior to the concept of interest. So as sedentary behavior increases, oxidative stress will increase. So if we can modify physical activity, so in animal studies, increases in reactive oxygen species such as NADPH oxidase and atherosclerotic lesion formation were observed in sedentary treatment condition. Conversely, when physical activity is introduced, it lowers oxidative stress by lowering antioxidant levels, which limit free radical production and the resulting oxidative damage. Some of these structural changes may make hypertension resistant to pharmacological therapy, which is where the particularly resistant piece of hypertension comes in, because we are making structural changes to the vascular system. Oxidative stress alters renal hemodynamics, so how the blood flows through the kidneys, causes vascular calcification, so there's less plasticity in the vascular system, and endothelial disruption, so the endothelial cells do not work as properly as they should, and all of this may cause or worsen the outcome condition of resistant hypertension. And I have here just a diagram that I really like that links oxidative stress and hypertension. But all of it basically says that the oxidative stress results in that vascular dysfunction, renal injury, and cardiovascular fibrosis. So where does this fit? So when analyzing trends for nursing research, Heitkemper predicted a dramatic increase in the use of genetic markers and biomarkers. 8-OHDG is a biomarker that looks at waste products from oxidative stress. So this fits well within that prediction that we're going to use oxidative stress as a biomarker, or more biomarkers in general. Similarly, the NINR strategic plan proposes a research lens focus on prevention and health promotion. So physical activity is a well-known promoter of health and preventer of disease. Thank you so much for listening to my framework, and I look forward to hearing yours.